Hello, my name is Ryan Davis, and today I will be presenting our study titled Stratified Morbidity in Greater than 15% TBSA Pediatric Burns, a cohort study for prognostication and benchmarking. This work was conducted at the Children's Hospital of Michigan Burn Center through Wayne State University School of Medicine. In this study, we aim to better understand complication patterns and healthcare resource utilization in children with moderate to severe burns, and to evaluate how morbidity changes as burn size increases. Pediatric burns remain a major cause of morbidity and healthcare resource utilization worldwide. Despite advances in burn care, contemporary complication benchmarks for children with larger burns are not well defined. Most existing literature focuses on mortality outcomes, while modern data describing systemic and intra-abdominal complications across burn severity are limited. In particular, intra-abdominal complications such as abdominal compartment syndrome, intestinal necrosis, and bowel perforation are rarely described in pediatric burn cohorts. A clearer understanding of complication patterns across burn severity may improve prognostication, clinical surveillance, and early identification of high-risk patients. The primary objective of this study was to characterize complication rates and healthcare resource utilization in pediatric burns involving 15% or greater total body surface area, or TBSA. Our secondary objective was to evaluate whether patterns of morbidity differ across increasing TBSA severity bands. We hypothesized that increasing burn size would be associated with stepwise increases in morbidity, complications, and healthcare resource utilization. We conducted a retrospective cohort study at the Children's Hospital of Michigan, which serves as a regional pediatric burn center. The study period spanned 2015 through 2024. We included pediatric patients aged 18 years or younger with burns involving at least 15% TBSA. Patients were stratified into 4 TBSA groups: 15 to 19.9%, 20 to 29.9%, 30 to 49.9%, and greater than or equal to 50%. Stratifying patients by TBSA allowed comparison across increasing injury severity and helped control for burn size as an important confounding factor. Data for this study were extracted from the Institutional Burn Registry and the electronic medical record. Variables collected included burn size, measured as total body surface area, as well as key measures of healthcare resource utilization. These included hospital length of stay, total ventilator days, and whether mechanical ventilation was required. We also collected information on systemic complications, intra-abdominal complications, and mortality. Complications included pneumonia, acute respiratory distress syndrome, acute kidney injury, sepsis, and shock. To evaluate differences across TBSA groups, we used non-parametric statistical testing for continuous variables and Fisher's exact testing for categorical outcomes. These tests were selected because complication events were relatively uncommon, and the sample size within each TBSA band was modest. Outcomes were compared across TBSA strata to identify patterns of morbidity associated with increasing burn severity. A total of 94 pediatric patients met inclusion criteria for this study. The median age was 2 years, highlighting the vulnerability of very young children to severe burn injuries. The median burn size was 27% TBSA. The most common burn etiology was scald injury, accounting for approximately 61% of cases, followed by flame injuries, which accounted for 38%. We next examined how healthcare resource utilization changed across TBSA severity bands. Hospital length of stay increased stepwise with burn size. Patients with burns of 15 to 19% TBSA had a median hospital stay of approximately 11 days, while patients with burns greater than or equal to 50% TBSA had a median stay of 55 days. Mechanical ventilation requirements also increased significantly with increasing burn size, demonstrating the escalating intensity of care required for larger burns. When we examined systemic complications, we found that they clustered primarily in burns involving 30% TBSA or greater. In particular, rates of pneumonia, acute respiratory distress syndrome, acute kidney injury, and shock were all significantly higher in this higher severity burn group. In contrast, these complications were uncommon in burns involving less than 30% TBSA. We also evaluated intra-abdominal complications, which are rarely reported in pediatric burn cohorts. Although uncommon overall, abdominal complications were identified in several patients. These included abdominal compartment syndrome, intestinal necrosis, and bowel perforation. The overall incidence of intra-abdominal complications was 4.3%, and these events occurred primarily in patients with larger burns. Mortality in the cohort was also 4.3%, and importantly, all deaths occurred in patients with burns involving 30% TBSA or greater. Mortality increased with burn size, reaching 25% in patients with burns greater than 50% TBSA. In summary, several key findings emerged from this study. First, healthcare resource utilization increases stepwise with increasing TBSA severity. Second, systemic complications tend to cluster in burns involving 30% TBSA or greater. Third, respiratory and renal complications increase significantly as burn severity rises. And finally, although rare, intra-abdominal complications occur almost exclusively in patients with high TBSA burns. This study has several limitations. It represents a retrospective single-center cohort, which may limit generalizability. The overall sample size is relatively small, and rare complications such as intra-abdominal events limit statistical power. Additionally, retrospective studies rely on clinical documentation, which may introduce variability in recorded complications. In conclusion, pediatric burns involving larger TBSA are associated with substantial systemic and respiratory morbidity. Although uncommon, intra-abdominal complications occur primarily in patients with larger burns and may be under-recognized. These findings provide contemporary complication benchmarks that may assist with prognostication, guide clinical surveillance, and support the development of early warning tools for children with severe burn injuries. Future multi-center studies will be important to validate these findings and to refine risk stratification and management strategies for high TBSA pediatric burns. Thank you.